Well, hi everyone. This is Dr. Schroeder with this week's video introduction to week number 2 of our course in the principles of healthcare research. And got off to a pretty good start in week number 1. Very robust, very nice discussion. The focus of week number 1, of course, was discussing the general differences between qualitative and quantitative research. And to do that, we looked at two different research articles. The one was the Beck article on post-traumatic stress disorder and the lived experiences of women reporting post-traumatic stress after childbirth. And the other one was Kokalba and Associates on a study on the efficacy of hand massage on hospice patients in increasing comfort. And they're both very indicative of a qualitative and a quantitative study. Remember, the idea of a quantitative study is to anytime that we're looking for something to show a cause and effect, so if we're looking for one variable's effect on another, and this will occur anytime that we're trying to measure, for example, the effectiveness of a intervention, the effectiveness of a mode of treatment, or if we're trying to see if, are there any statistical changes in one particular set of data when compared with another, or when conditions are different. And there are certain key components of a quantitative article that we'll discuss later. But many of you had pointed out that there's a quantitative article has a hypothesis where the researcher essentially states what he or she anticipates may or may not happen. Actually, a hypothesis is most of you have learned a hypothesis probably as an educated guess, or kind of a guess of what the researcher thinks is going to happen. That's not necessarily always true. Really, a hypothesis is just a point of reference to say that if a certain set of criteria is met, then we can say that condition A is true. And if that condition is not met, condition B is true. So it may or may not necessarily be what the researcher actually thinks will happen, but more it's a statement of it's kind of an either or. So you can say that statistically, one side of an equation is proved versus another. And so that's kind of a fine point, and we'll talk about that a little bit later. But that's really kind of what the point of a quantitative study is all about. And this study was very quantitative, the Kokalba study, because it was looking for a cause-effect relationship. Does a hand massage increase comfort in these patients? It's measured empirically, it's measured statistically, and the results are based on the patient's reports of comfort using a questionnaire or using a comfort tool used to actually measure that comfort. That is actually a quantitative piece of data. So it was not a qualitative data or a qualitative article. A lot of times people will look at that and say, well, this is something that should be reviewed qualitatively because it's a subjective experience. But that's not really the point. Really, the point of the article isn't trying to find out what the lived experiences of these individuals are. It's trying to say, is there a specific outcome from this intervention that we're providing? And of course, that contrasts with the Beck article that was clearly qualitative, where there was no hypothesis, there was no anticipation by Beck as to what these women's experience would be. She was just trying to kind of get to the bottom of it. What is this phenomenon that they're experiencing? What is it like? She wasn't trying to prove whether it was or wasn't real. She wasn't trying to validate anything other than just these women's statement of what they were experiencing or what they felt. And so that's what made it a qualitative study. Reads much differently, as you probably noticed. Qualitative studies tend to be much more narrative and much more intuitive, and many people would find them more interesting to read as opposed to a quantitative study that, quite frankly, is usually about as exciting as reading a recipe book, because that's kind of how they're laid out. It's a lot of facts and certain arguments that are made from those deductive facts. A couple of you also mentioned that these studies would have been good if they were reviewed using a mixed methodology. And mixed methodology is where a researcher uses both qualitative and quantitative measures. But there's a lot of good reasons why researchers won't use mixed methods for every study. not the least of which is that it really increases the amount of time, it increases the number of resources, and it increases the burden on the subjects themselves because they have to participate then on two sides of a research study. And it really can be time consuming. And so therefore, again, it depends on what the question is. The question is just looking for a straight cause effect from an intervention. There's really no sense, there's no need to do a qualitative study. And so that study would just be done quantitatively. And likewise, if a researcher is just trying to find out more about something because little is known about it, and we're trying to get a baseline of data, then a qualitative study would be best. So that's why a mixed method study isn't necessarily always the best. It depends on what the research question is. And that brings us to week number 2. In week number 2, essentially your task is twofold. Again, discussion question this week. You're going to be talking about peer-reviewed literature and the differences between primary and secondary sources, talking about the various databases and how you use those databases. And then the last part of the question is you're going to post a research question to identify, you're going to identify a problem that you would identify in nursing, or a problem that you know to be a problem in nursing. Maybe find a little bit of information or maybe an article to support it, and then identify if you would use a qualitative or quantitative methodology, and then a research question that aligns with that. And I'll be giving feedback on that, on how your research questions, how they align with a qualitative or a quantitative methodology. Remember, it's the research question, not the topic itself, that determines whether a research is going to be conducted using a quantitative or a qualitative methodology. For the purpose of this particular study, don't include mixed methodology. Just go ahead and identify a qualitative or a quantitative methodology and a research question that would go with that. And even though the problem that you're looking at may very well work well with a mixed methods approach, mixed methods is problematic in certain ways. And we'll talk about that a little bit later in class. For now, we'll stick with the qualitative and quantitative from those broad brushstroke overviews. The grading for this week will be completed early in week number 2, possibly as early as Monday. I'm recording this Sunday night of Labor Day weekend, by the way. Hope everybody's having a great Labor Day. So I'll probably get the discussion questions graded on Monday. If not on Monday, it will be early in week number 2. And then we'll be continuing on with discussion this week. Remember, discussion questions should be posted, your initial response no later than Wednesday. Make sure also, a few of the questions this week I noticed were very similar in structure, similar in format. Your discussion questions should be unique, even though you're addressing the same questions. Be careful not to use the same information or paraphrase the same information from other individuals in the class. Make sure that your contributions are always original. That's very important. And your responses, remember, I follow the rubric. You should be posting throughout the week, not just on 1 or 2 days each week. For full credit really means a minimum of 4 responses posted on a minimum of 3 days with some unique insights in each one of those. If you're able to meet that criteria, then you would end up getting full credit. And then if you do post, all your posts come on, say, like Saturday on the same day of the week after your initial post on Wednesday, and there's not really any evidence of an ongoing discussion or any evidence that you've really reviewed a lot of the discussion questions, then your discussion grade will be a little bit less than optimal. So, but you'll get a better idea after I give the grading this week. So I hope everybody has a great week. I look forward to once again participating in class with you. I will be reviewing your research questions that you develop and giving feedback on those primarily. And I'm looking forward to a great week of discussion. So if you have any questions, as always, feel free to let me know. Have a great week. Have a great Labor Day. If you're seeing this before the Labor Day weekend's over, I hope that you're having Good fun in this last days of summer, and we'll see you in the discussion forum.